Hi everyone, welcome to my channel, The NP Mentor. I am happy you're here. I am Daphnee, a nurse practitioner and also the founder of the NP Mentor. I offer mentorship to nursing students, nurse practitioner students, and new NPs. But on this page, I help nursing and NP students stop feeling overwhelmed and start feeling confident. I share exam passing tips, real world clinical pearls, and shortcuts that school doesn't teach you. The stuff that you actually need to know. Don't forget to subscribe and also leave me a thumbs up at the end of this video to let me know how this is helping you and also how I can better serve you. Again, I am happy you here. The topic today is on hypertension. Let's get started. So let's talk about hypertension, what you need to know. So this is a quick 5-minute review of hypertension. So this is one of the most heavily tested topics on the nurse practitioner exam. So this will cover exactly what you need to know to pass your exam and also help you in the clinical world. So make sure that you watch this video entirely and save it. So hypertension is defined as a persistent blood pressure of 130 over 80 or higher. It is one of the leading risk factors for cardiovascular disease, stroke, and kidney failure. Many patients, they are asymptomatic, which is why it is often called the silent killer. So you always need to remember, lack of symptoms does not mean lack of disease. So for your exam, you need to know these categories, okay? So you need to know what's normal, what's elevated, your stages of hypertension. And on this slide, you'll see that a normal hypertension is anything under 120 over 80, and elevated is systolic 120 to 129 with a normal diastolic, and know your stage 1 130 to 139 or 80 to 89, and your stage 2 anything over 140 or 90 or higher. Okay, so the exam often gives numbers and asks you to classify the stage, so make sure that you don't miss these questions. Quick tips on hypertension. So hypertension is not diagnosed from a single reading. You need an average of 2 or more readings on at least 2 different visits. So your patient, you see them the first time, and then they can have a log, go home, and then on this different visit, now you can make a proper diagnostic. And make sure that you use the proper cuff size and positioning is used correctly so they cannot cross their legs and all that. So if readings are borderline, let's say that their log that they have at home is different from the one that you have at the office, make sure you consider white coat hypertension. Okay, something that's very important, you need to know about the lifestyle changes. So this is the first line for all patients regardless of stage. So this includes the DASH diet. Make sure you educate your patient on reducing sodium intake to less than 1.5 to 2 grams per day. Talk to them about weight loss, regular physical activity, and limiting alcohol. So this is a very good thing to remember. So lifestyle modification is always part of the answer. And then you can think about medications. Now let's talk about the medications for hypertension. The first line medications tested on the exams include thiazide diuretics, the ACE, ARBs, calcium channel blockers. I will be posting more videos about the medications, what you need to know, the side effects. And remember that the beta blockers, they are not first line unless there's another indication like heart failure or post MI. And if you see uncomplicated hypertension, take one of these four classes of medication. So on this slide, you really need to know this information for your exam and also when you're practicing as a nurse practitioner. So this is a high yield exam slide. Remember, your diabetic patients, your chronic kidney disease patients, they should be on an ACE or ARB for renal protection. And your black patients, they respond best to thiazides or calcium channel blockers. And pregnancy, your pregnant patients, you have to be careful with them. They can be on either metildopa, labetalol, beta blockers, or diuretics. You need to remember this. You need to avoid ACE or ARBs in pregnancy because they are contraindicated. Uncontrolled hypertension can lead to serious complications, including stroke, myocardial infarction, heart failure, chronic kidney disease, and retinopathy. So, if the exam asks why hypertension must be treated even when asymptomatic, these complications are the answer. And remember to educate your patients to always check their blood pressure and to take their blood pressure medications as directed. Final examples. Stage 1 hypertension should be treated with medication if the patient's 10-year ASCVD risk is 10% or higher. Blood pressure goals are usually less than 130/80. Lifestyle modification is always recommended. So you have to remember this. And you must know the medication contraindications, especially in pregnancy. Know the side effects, the classes of the blood pressure medications. So now let's have a Q&A, okay? So let's go over this question here. A 56-year-old African American male presents to your clinic for a routine visit. His average blood pressure over 2 visits is 148/92. He has no history of diabetes, chronic kidney disease, or cardiovascular disease. So which of the following is the most appropriate initial pharmacologic treatment for this patient? Is it lisinopril, B, metoprolol, C, hydrochlorothiazide, or D, losartan? So the correct answer is C, hydrochlorothiazide. So the patient has stage 2 hypertension. Blood pressure is over 140/90. So in black patients without CKD or diabetes, thiazide diuretics or calcium channel blockers are recommended for first therapy. ACE inhibitors and ARBs, they are less effective as monotherapy in this population unless CKD is present. And the beta blockers, they are not first line for uncomplicated hypertension. So here you have it. The correct answer is C. Well, thank you for watching this video. Remember to subscribe and I'll see you again next week. We'll go over some hypertension medications. And remember to put your comment down. I will read them and answer your questions.